treatment of 6. 4. The client who is receiving antineoplastic medications. 2. Which client should Ms. Cindy assign to the medical surgical nurse who is being pulled to work on the oncology unit for this shift? 1. The client diagnosed with non-Hodgkin's lymphoma who is having complications from daily radiation treatments. 2. The client diagnosed with Hodgkin's disease who is being prepared for a bone marrow transplant. 3. The client diagnosed with leukemia who has petechiae covering both anterior and posterior body surfaces. 4. The client diagnosed with ovarian cancer who is 1 day postoperative total abdominal hysterectomy. 3. Ms. Kathy, an RN, and Ms. Teresa, the UAP, are caring for a group of clients. Which information provided by Ms. Teresa warrants immediate intervention by Ms. Kathy? 1. The client diagnosed with bladder cancer who has bright red blood in the urinal. 2. The client receiving chemotherapy who is complaining of pain in the mouth. 3. The client with a biological response modifier who has AT 99.2 degrees Fahrenheit, P68, R24, and BP of 198/102. 4. The client receiving a steroid who is complaining of having a rounded swollen face. 4. Ms. Kathy is caring for a client that is 1 day postoperative sigmoid resection and notes bright red bleeding on the midline abdominal incision. Which intervention should Ms. Kathy implement first? 1. Assess the client's vital signs. 2. Reinforce the abdominal dressing. 3. Notify the healthcare provider. 4. Place the client in the Trendelenburg position. 5. Which nursing task should Ms. Kathy, the RN, delegate to Ms. Paula, the UAP? 1. Discontinue the client's subclavian intravenous catheter. 2. Empty the Jackson-Pratt drainage tube and record amount. 3. Determine if the client's pain medication has been effective. 4. Perform irrigation for the client who is 2 days post-op abdominoperineal resection. 6. The client is 2 days post-ureterosigmoidostomy for cancer of the bladder. Which assessment data warrants Ms. Mary notifying the HCP? 1. The client has excreted urine from the rectum. 2. The client's abdominal incision is slightly reddened. 3. The client has an apical rate of 98 and B/P114/80. 4. The client has a low-grade fever and a hard, rigid abdomen. Hematological and Immunological Clinical Scenario Chapter 10 Hematological and Immunological Management 283 Clinical Scenario 7. Ms. Mary identifies a problem of anticipatory grieving for a client diagnosed with stage 4 ovarian cancer. Which nursing intervention is priority for this client? 1. Request the client is referred to hospice. 2. Encourage the client to make plans for her funeral. 3. Allow the client to verbalize feelings about having cancer. 4. Discuss an advance directive and a power of attorney for health care. 8. The client diagnosed with ovarian cancer has had 5 courses of chemotherapy. Which laboratory data warrant immediate intervention by Ms. Mary? 1. Absolute neutrophil count, ANC, of 681 mm/dl. 2. Platelet count of 175,000. 3. Red blood cell count of 5.0 × 106. 4. Hemoglobin of 11.2 and hematocrit 37%. 9. Ms. Mary is performing a head-to-toe assessment on a Hispanic client diagnosed with prostate cancer. The nurse notes an irregular-shaped lesion with some scabbed over area surrounding the lesion. Which intervention should Ms. Mary implement first? 1. Take no action since this is a common lesion found on Hispanic skin. 2. Assess the lesion by completing the ABCDs of skin cancer. 3. Document the findings in the client's nurse's notes. 4. Instruct the client to make sure the HCP checks the lesion. 10. The female client diagnosed with pancreatic cancer has an advance directive, AD, stipulating no cardiopulmonary resuscitation. Which intervention should Ms. Kathy implement first? 1. Notify the client's healthcare provider about the AD. 2. Determine if the client has discussed the AD with significant others. 3. Place a copy of the advance directive in the client's chart. 4. Give the original advance directive to the client. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. This is boundary crossing because the nurse does not have breast cancer. The nurse should assess what information the client is really seeking and then explain the treatment or refer the client, as appropriate. 2. The nurse must assess what information the client actually needs. To do this, the nurse must know what treatment options have been suggested to the client. Assessment is the first step in the nursing process. 3. This may be needed after the nurse further assesses the situation, but this is not the first intervention. 4. The client needs information about treatment options from a designated HCP. The significant other would not have such information/suggestions. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, health promotion and maintenance, cognitive level, analysis. 2. 1, 3, and 5 are correct. 1. The nurse should begin a systematic search of the unit after activating the bomb scare emergency plan, and if any suspicious objects are found the nurse should not touch them, and should notify the bomb squad. 2. The nurse should notify the house supervisor and administration because they are responsible for notifying the police department. 3. The nurse should stay calm and try to keep the caller on the telephone. The nurse should attempt to get as much information from the caller as possible. The nurse can jot a note to someone nearby to initiate the bomb scare procedure. 4. The red emergency levers in hospitals are to notify the fire departments of a fire, not a bomb scare. 5. The nurse should try to transcribe exactly what the caller says. This may help identify who is calling and where a bomb might be placed. Content: management, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, comprehension. Making nursing decisions, the nurse must be knowledgeable of hospital emergency preparedness. Students as well as new employees receive this information in hospital orientations and are responsible for implementing procedures correctly. The NCLEX-RN registered blueprint includes questions on the safe and effective care environment. 3.1. The new graduate must work under this charge nurse. Confronting the nurse would not resolve the issue because the nurse can choose to ignore the new graduate. Someone in authority over the charge nurse must address the situation with the nurse. 2. The night supervisor or the unit manager has the authority to require the charge nurse to submit to drug screening. In this case, the supervisor on duty should handle the situation. 3. The new graduate is bound by the Nursing Practice Acts to report potentially unsafe behavior regardless of the position the nurse holds. 4. The nurse educator would not be in a position of authority over the charge nurse. Content: management, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, when the nurse is deciding on a course of acti. On involving other staff members, a rule of thumb is this: if the individual the nurse is concerned about is superior in job title to the nurse, then the nurse should go through the chain of command to the next level of superior. If the individual is subordinate in job title to the nurse, then the nurse should confront the individual. 4.1. This should be done if the murmur is a new finding. However, the nurse should investigate the finding further before notifying the HCP. 2. This should be done, but assessing the client's situation is the nurse's priority. 3. Although the client was not admitted for a cardiac problem, she may have had a murmur for a while, and the previous nurse did not pick it up or did not mention it in the report because it was a long-standing physiological finding in this client. The nurse should research the chart for a current history and physical to determine whether the HCP is aware of the condition. Answers and rationales. 284 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 10 Hematological and Immunological Management. 285 4. The nurse should not ask the client because this could scare or alarm the client needlessly. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. 5. 1. The client's lab work does not indicate an increased risk for infection. The client does not need to be placed in reverse isolation. 2. The lab work is within normal limits. The nurse does not need to notify the HCP. 3. The client is not at an increased risk for infection. Therefore, the client may have flowers in the room. 4. This client's lab work is within normal limits. The nurse should continue to monitor the client. Content: medical/surgical, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. 6. 1. The nurse should stop the behavior occurring in a public place. The charge nurse can discuss the issue with the UAPs and determine whether the manager should be notified. 2. The first action is to stop the argument from occurring in a public place. The charge nurse should not discuss the UAP's behavior in public. 3. The second action is to have the UAPs go to a private area before resuming the conversation. 4. The charge nurse may need to mediate the disagreement. This would be the third step. Content: management, category of health alteration, hematology, integrated processes, communication and documentation, client needs, safe and effective care environment, management of care, cognitive level, comprehension. 7. 1. The graduate nurse should handle the situation directly with the UAP first before notifying the charge nurse. 2. This may need to be completed, but not prior to directly discussing the behavior with the UAP. 3. The graduate nurse must address the insubordination with the UAP, not just complete the tasks that are the responsibility of the UAP. 4. The graduate nurse must discuss the insubordination directly with the UAP first. The nurse must give objective data as to when and where the UAP did not follow through with the completion of assigned tasks. Content: management, category of health alteration, oncology, integrated processes, communication and documentation, client needs, safe and effective care environment, management of care, cognitive level, application. 8. 1. The client's ability to swallow is not impaired prior to the surgical procedure. 2. The client will not be able to speak after the removal of the larynx, therefore, referral to a speech therapist who will be able to discuss an alternate means of communication is priority. 3. The HCP, not the nurse, is responsible for ordering the preoperative laboratory work. 4. The HCP, not the nurse, is responsible for discussing the operative permit. Content: oncology, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis. Making nursing decisions, the test taker must be aware of the setting that ultimately dictates the appropriate intervention. The adjectives will clue the test taker to the setting. In this question, the words clinic nurse clue the test taker to the setting. The test taker must also remember the nurse's scope of practice and realize that options 3 and 4 are outside the nurse's scope of practice. 9.1. This client is not stable and requires a more experienced nurse. 2. An elevated temperature indicates a potential complication of surgery. Therefore, this client requires a more experienced nurse. 3. Of the 4 clients, the one who is most stable is the client who has just undergone a breast biopsy, therefore, this client would be the most appropriate to assign to a new graduate nurse. 4. Unrelenting pain requires further assessment, therefore, the client should be assigned to a more experienced nurse. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions, when the test taker is deciding which client should be assigned to a new graduate, the most stable client should be assigned to the least experienced nurse. 10.1. The LPN can administer intravenous antibiotic medication according to the LPN scope of practice. 2. The UAP should be instructed to empty the indwelling urinary catheter, not the LPN. 3. The LPN should not be assigned to assess a client. Answers. 4. The LPN should not be assigned to evaluate the client's understanding of the discharge teaching. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to an LPN. 11.1. This should not be implemented until verification of the allegation is complete, and the shift manager has discussed the situation with the UAP. 2. The shift manager should have objective data about the allegation of falsifying vital signs prior to confronting the UAP, therefore, the shift manager should take the client's vital signs and compare them with the UAP's results before taking any other action. 3. The shift manager should not confront the UAP until objective data are obtained to support the allegation. 4. Written documentation should be the last action when resolving staff issues. Content, management, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 12. 1. If the nurse tells the client the truth at this time, the client may ask, "What happens now? How long do I have to live?" In this situation, the nurse should not tell the client the truth. 2. The client does have a right to a second opinion, but in this situation the nurse should encourage the client to talk to the surgeon. 3. This is a therapeutic response that encourages the client to ventilate his or her feelings, but the client needs answers. This is not the best response by the nurse. 4. Since the nurse knows the client is terminal, it would be best for the nurse to encourage the client to talk to the surgeon. The client needs the truth and the surgeon is the person who should tell it to the client. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, analysis making nursing decisions. The nurse needs to be able to guide clients to the correct person when they have questions about their health care. 13.1. The nurse should first assess the client prior to taking any other action to determine if the client is experiencing any untoward reaction. 2. An incident report must be completed by the nurse, but not prior to taking care of the client. 3. The nurse should administer the correct medication, but not prior to assessing the client. 4. The client's HCP must be notified, but the nurse should be able to provide the HCP with pertinent client information, so this is not the first intervention. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. Whenever something happens to the client, the nurse should first assess the client prior to taking any other action. 14.1. The client must be taught postoperative care, but this is not the priority intervention of the clinic nurse. 2. Sperm banking will allow the client's sperm to be kept until the time the client wants to conceive a child. This is priority because it must be done between the clinic visit and admission to the hospital for the procedure. The unilateral orchiectomy will not result in sterility, but the subsequent treatments may cause sterility. 3. The nurse can discuss the testicular prosthesis, but this is not priority over sperm banking because the prosthesis may or may not be inserted at the time of surgery. 4. A referral to the ACS is appropriate, but is not the most important information a 24-year-old male client needs at this time. Content: Oncology, Category of Health Alteration, Oncology, Integrated Processes, Nursing Process, Planning, Client Needs, Physiological Integrity, Physiological Adaptation, Cognitive Level, Synthesis 15. 1. Because the client is in the preoperative holding area, the immediate safety need for the client is to inform the operating room personnel so that no latex gloves or equipment will come into contact with the client. Person-to-person communication for a safety issue ensures that the information is not overlooked. 2. The nurse should label the chart with the allergy, but because the client is in the preoperative holding area, this is not the first intervention. 286 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 10 Hematological and Immunological Management 287 3. The nurse should place a red allergy band on the client, but because the client is in the preoperative holding area, this is not the first intervention. 4. The nurse should always teach the client, but at this time the first intervention is the client's safety, which is why the OR team should be notified. Content: Medical/Surgical, Category of Health Alteration, Oncology, Integrated Processes, Communication and Documentation, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Application 16. 1. The serum blood glucose level requires a venipuncture, which is not within the scope of the UAP's expertise. The laboratory technician would be responsible for obtaining a venipuncture. 2. This is a sterile dressing change and requires assessing the insertion site for infection. Therefore, this would not be the most appropriate task to assign to the LPN. 3. The nurse should ask the UAP to bathe the client and change bed linens because this is a task the UAP can perform. The LPN could be assigned higher-level tasks. 4. The UAP can add up the urine output for the 12-hour shift, however, the nurse is responsible for evaluating whether the urine output is what is expected for the client. Content: Management of Care, Category of Health Alteration, Oncology, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis. Making nursing decisions, when the test taker is deciding which option is the most appropriate task to delegate/assign, the test taker should choose the task that allows each member of the staff to function at his or her full scope of practice. Do not assign a task to a staff member that requires a higher level of expertise than the staff member has, and do not assign a task to a staff member when another staff member with a lower level of expertise can do it. 17.1. The client on the ventilator is unstable. Therefore, the nurse should not delegate any tasks to the UAP. 2. The UAP can take specimens to the laboratory, it is not medications and not vital to the client. 3. The client in an Addisonian crisis is unstable, therefore, the nurse should not delegate any tasks to the UAP. 4. The UAP cannot assist the HCP with an invasive procedure at the bedside. Content: Medical/Surgical, Category of Health Alteration, Oncology, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis. Making nursing decisions, the nurse cannot delegate assessment, teaching, evaluation, medication, or an unstable client to a UAP. 18.1. The client with intracavity radiation could cause problems with the pregnant nurse's fetus, so she should not be assigned to this client. 2. The pregnant nurse can be assigned to a client who is HIV positive. The nurse must adhere to standard precautions. 3. The cytomegalovirus could harm the nurse's fetus, so the pregnant nurse should not be assigned to this client. 4. The I-131 is radioactive iodine and a pregnant nurse should not be near radiation. Content: medical/surgical, category of health alteration, hematology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The NCLEX-RN registered has questions asking the test taught to address making assignments on units. Nurses who are pregnant should not care for clients whose condition can harm the fetus. 19.1. The nurse will need to check the client's HNH but not prior to notifying the HCP. The client has disseminated intravascular coagulation, DIC. 2. Monitoring the client's pulse oximeter reading would be an intervention the nurse could implement, but it is not the first intervention for a client with DIC. 3. Applying pressure to the foresight will not help stop the bleeding since the client's coagulation factors have been exhausted. The client must receive heparin therapy. 4. The client is exhibiting signs of DIC, which requires intravenous therapy. This is a life-threatening complication that requires immediate medical intervention, so the nurse must notify the HCP first. Content: medical/surgical, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. When the stem of the question provides all T. He data needed to determine whether the client is in life-threatening distress, the nurse must contact the client's healthcare provider. Answers 20. 1. The feelings of the staff are not a violation of the client's rights. Refusing to care for the client is a violation of the client's rights. 2. Transferring the client to the medical unit solves the problem for the critical care unit, but the client's behavior should be addressed by the healthcare team. This is not the most appropriate intervention for the nurse manager. 3. This would be the most appropriate intervention because it allows the staff to have input into resolving the problem. When staff have input into resolving the situation, then there is ownership of the problem. 4. One nurse cannot be on duty 24 hours a day. The nurse manager should try to allow the staff to identify options to address the client's behavior. Content: management of care, category of health alteration, hematology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, application 21. 1. The client must have lost decision-making capacity because of a condition that is not reversible, or must be in a condition that is specified under state law, such as a terminal, persistent vegetative state, irreversible coma, or as specified in the advance directive. A client who is exhibiting decerebrate posturing is unconscious and unable to make decisions. 2. The client on a ventilator has not lost the ability to make healthcare decisions. The nurse can communicate by asking the client to blink his or her eyes to yes/no questions. 3. The client receiving dialysis is alert and does not lose the ability to make decisions, therefore, the advance directive should not be consulted to make decisions for the client. 4. Mental retardation does not mean the client cannot make decisions for him or herself unless the client has a legal guardian who has a durable power of attorney for health care. If the client has a legal guardian, then the client cannot complete an advance directive. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, basic care and comfort, cognitive level, analysis 22. 1. This nurse should be sent to the medical unit because, with 18 months experience, the nurse is familiar with the hospital routine and would be helpful to the medical unit but is not the most experienced ICU nurse on duty. 2. The nurse who is still orienting to the unit should not be sent to the medical unit. The nurse in orientation should be kept with the nurse preceptor. 3. The nurse who is new to the hospital should not be sent to a new unit with which he or she is unfamiliar. 4. The nurse with 12 years experience should be kept on in the ICU because his or her expertise would be more helpful for client care than a nurse with 18 months experience. Content, management, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 23. 1. The family may or may not be able to control the client's behavior, but the nurse should not ask a family member first. The CCU usually has mandated visiting hours. 2. The nurse should first ensure the client's safety by having someone stay at the bedside with the client, and then call the HCP, and finally apply mid restraints. 3. This is a form of restraint and is against the law unless the nurse has a healthcare provider's order. This is the least restrictive form of restraint but would not be helpful if the client is pulling at tubes. 4. The nurse must notify the healthcare provider before putting the client in restraints. Restraints must be used only in an emergency situation, for a limited time, and for the protection of the client. Content, medical/surgical, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 24. 1 and 2 are correct. 1. The UAP can perform AM care, therefore, this can be delegated to the UAP. 2. Washing the hair of female clients can be delegated to the UAP. 3. The UAP should not cut the toenails of clients, this should be referred to a podiatrist. 4. The clients should be turned every 2 hours, not every shift. 5. The housekeeping department should empty the waste baskets, not the UAP. Content, medical/surgical, category of health alteration, hematology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot delegate assessment, teaching, evaluation, medications, and an unstable client to the UAP. 288 Prioritization, delegation, and management of care for the NCLEX-RN registered exam Chapter 10 Hematological and Immunological Management 289-25. 1. The nurse can praise the UAP for safety concerns, but first the sheet must be removed because it is a form of restraint and is illegal. 2. The nurse must remove the sheet since it is a restraint. There must be an HCP's order prior to restraining a client. 3. The nurse should discuss the restraint policy with the UAP but not prior to removing the restraint. 4. The nurse should determine if the client needs restraints for safety and then call and obtain the order, but not prior to removing the sheet. A chest restraint could be used to secure the client to the chair if needed. Content, medical/surgical, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions. The nurse must ensure the UAP provides legal and ethical nursing care to the clients in the long-term care facility. 26.1. The UAP could place antithrombolism hose on the client. 2. The UAP should not escort the client outside to smoke a cigarette. The UAP will be off the unit and this encourages poor health habits. 3. The LPN should administer a tube feeding, not the UAP. 4. The UAP can change a colostomy bag on a client who has had it for an extended period of time, which is implied since the client is in a long-term care center. Content, medical/surgical, category of health alteration, hematology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The charge nurse should not assign a task to T. HELPN that a UAP could implement. 27.1. The UAP can apply sequential compression devices to the client on strict bed rest. 2. The UAP can assist with a portable stat chest X-ray as long as it is not a female UAP who is pregnant. 3. The client will need to be pre-medicated for a wound debridement, therefore, this task cannot be delegated to the UAP. 4. The UAP can obtain intake and outputs for clients. Content, medical/surgical, category of health alteration, hematology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot delegate assessment, teaching, evaluation, medications, and an unstable client to the UAP. The nurse cannot delegate pre-medicating the client. 28.1. Asking the dietitian to consult with the client is a good intervention, but the nurse should assess the impact of the change in taste on the client. 2. The client did not complain of nausea. Antiemetic medication is used to prevent nausea associated with food odors and attempting to eat. 3. The nurse can recommend an over-the-counter supplement to increase nutrition, but the nurse should first assess the impact of the problem. Over-the-counter supplements are expensive, and the nurse should suggest the client try malts, milkshakes, and fortified soups. Then, if the client does not like or gets tired of the taste, a family member can consume the food and it is not wasted. 4. Checking the client's weight change over a period of time is the first step in assessing the client's nutritional status and the impact of the taste changes on the client. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker should employ a systematic approach to problem solving. The nursing process is a systematic approach, and assessment is the first step of the nursing process. 29.1. A quality improvement project looks at the way tasks are performed and attempts to see whether the system can be improved. A medication delivery system in which it takes a long time for the nurse to receive a stat or now medication is an example of a system that needs improvement and should be addressed by a quality improvement committee. 2. Financial reimbursement of the staff is a management issue, not a quality improvement issue. 3. Collective bargaining is an administrative issue, not a quality improvement issue. 4. The number of medication errors committed by a nurse is a management-to-nurse issue and does not involve a systems issue, unless several nurses have committed the same answers error because the system is not functioning appropriately. Content, management, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 30. 1. This is an example of autonomy. The client needs all pertinent information prior to making an informed choice. 2. This is an example of fidelity. Fidelity is the duty to be faithful to commitments and involves keeping information confidential and maintaining privacy and trust. 3. This is an example of veracity, the duty to tell the truth. 4. This is an example of non-malfeasance, the duty to do no harm. This avoids telling a client facing surgery that he has cancer. Content, nursing ethics, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, comprehension 31. 1. An elevated amylase would be expected in a client diagnosed with acute pancreatitis. The nurse would not need to call the HCP immediately. 2. An elevated WBC would be expected in a client diagnosed with a septic, infected, leg wound. The nurse would not need to call the HCP immediately. 3. The urinalysis report showing many bacteria is indicative of an infection. Clients receiving chemotherapy are at high risk of developing an infection. The nurse should notify the HCP immediately. For this blood glucose level is above normal range but would not be particularly abnormal for a client diagnosed with type 1 diabetes. The nurse would not need to call the HCP immediately. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 32. 1. The resident's WBC count is within normal limits and indicates an ability to resist infection. The nurse should not place this resident in reverse isolation. 2. The resident's HNH is slightly lower than normal but not low enough to cause dyspnea during activity. The resident does not need oxygen. 3. The resident's platelet count is very low and could cause the resident to bleed. The nurse should initiate bleeding precautions that include not using sharp blades to shave the resident and using soft bristle toothbrushes. 4. The client is not at risk for developing an infection. The client does not need his temperature checked every 4 hours. Content: medical/surgical, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 33. 1. A secondary nursing intervention includes screening for early detection. The bone density evaluation will determine the density of the bone and is diagnostic for osteoporosis. 2 spinal screening examinations are performed on adolescents to detect scoliosis. This is a secondary nursing intervention, but not to detect osteoporosis. 3 teaching the client is a primary nursing intervention. This is an appropriate intervention to help prevent osteoporosis, but it is not a secondary intervention. 4. Discussing risk factors is an appropriate intervention, but it is not a secondary nursing intervention. Content: medical/surgical, category of health alteration, hematological, integrated processes, nursing process, analysis, client needs, health promotion and maintenance, cognitive level, comprehension 34. 1. This is the nurse's priority intervention because any emergency personnel who may come into contact with the client should be aware of the client's allergy. A penicillin allergy can kill the client. 2. The client's pharmacy can be made aware of the allergy, but this is helpful only when the client is having prescriptions filled. 3. Unless the client has an allergy to penicillin dust, which is rare, coming into contact with another person taking penicillin will not cause the client to have an allergic reaction. 4. Therapeutic communication allows the client to ventilate feelings, which is an appropriate intervention, but it is not priority over teaching the client how to prevent a potentially life-threatening reaction. Content: medical/surgical, category of health alteration, hematological, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis 290 prioritization, delegation, and management of care for the NCLEX-RN. Registered Exam Chapter 10 Hematological and Immunological Management 290-135. 1. The clinic nurse should not confront the staff nurse without objective data that support the allegation. 2. The State Board of Nurse Examiners cannot do anything to the nurse until the nurse has been convicted of the crime. Many states have programs to help addicted nurses, and some states may revoke the nurse's license to practice nursing. 3. The clinic nurse should report the suspicions so that appropriate actions can be taken, such as a urine drug screen for the nurse, watching the nurse for the behavior, and possibly notifying the police department. 4. The nurse should follow the chain of command, which does not include the HCP. Content: legal, category of health alteration, hematological, integrated processes, communication and documentation, client needs, safe and effective care environment, management of care, cognitive level, application 36. 1. The nurse can or cannot place a bandage over the injection site. This is not a priority intervention. 2. Warm compresses will help increase the absorption of the medication, but this is not the priority nursing intervention. 3. The medication injection must be documented in the client's chart in a clinic, just as it must be in an acute care area, but documentation is not priority over a possible life-threatening allergic reaction. 4. The client is at risk for having an allergic reaction to the penicillin, which is a life-threatening complication. Therefore, the client must stay in the waiting room for at least 30 minutes so the nurse can determine whether an allergic reaction is occurring. Content: medical/surgical, category of health alteration, hematological, integrated processes, nursing process, evaluation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application 37. 1. Isometric exercises such as weightlifting increase muscle mass. The HH nurse should not instruct the HH aide to do this type of exercises. 2. The HH aide may go to the emergency department, but the HH nurse should address the aide's back pain. Many times, the person with back pain does not need to be seen in the emergency room. 3. An occurrence report explaining the situation is important documentation and should be completed. It provides the staff member with the required documentation to begin a workers' compensation case for payment of medical bills. However, the HH nurse on the phone should help decrease the HH aide's pain, not worry about paperwork. 4. The HH aide is in pain, and applying ice to the back will help decrease pain and inflammation. The HH nurse should be concerned about a coworker's pain. Remember, ice for acute pain and heat for chronic pain. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 38. 1. Allowing the client to stay in bed is inappropriate because a client with osteoarthritis should be encouraged to move, which will decrease the pain. 2. A bath at the bedside does not require as much movement from the client as getting up and walking to the shower. This is not an appropriate action for a client with osteoarthritis. 3. Movement and warm or hot water will help decrease the pain. The worst thing the client can do is not to move. The HH aide should encourage the client to get up and take a warm shower or bath. 4. Osteoarthritis is a chronic condition, and the HCP could not do anything to keep the client from hurting all over. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, comprehension 39. 1. The HH aide's responsibility is to care for the client's personal needs, which include assisting with AM care. 2. The HH aide is not responsible for cooking the client's meals. 3. The HH aide is not responsible for taking the client to appointments. This also presents an insurance problem, since the client is in the HH aide's car. 4. Even in the home, the HH nurse should not delegate teaching. Content: management of care, category of health alteration, hematological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot delegate assessment, evaluation, teaching, medications, or care of an unstable client to a UAP, including an HH aide. Answers 40. 1. If the HH aide is fearful for any reason, the HH aide should not go into the home and should notify the agency. The employee's safety is important. This statement does not require reteaching. 2. For safety purposes, the HH aide should be clearly identified when entering the client's neighborhood and home. This statement does not require reteaching. 3. The HH aide should be able to contact the HH nurse or agency about any potential or actual concerns. This is for the safety of the client as well as the employee. This statement does not require reteaching. 4 standard precautions apply in the home as in the hospital. If the HH aide has the potential to touch the client's bodily fluids, then the aide should wear gloves and wash his or her hands. The statement indicates the HH aide needs reteaching. Content: medical/surgical, category of health alteration, musculoskeletal integrated processes, teaching/learning, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis making nursing decisions, according to the NCLEX-RN registered test blueprint. Staff education is a component of the management of care. 41.1. The client diagnosed with Guillain-Barré syndrome would have been on bed rest for days to weeks and would be in a debilitated state, therefore, reports of being tired all the time would be expected. This client would not require the most experienced nurse. 2. The client with pressure ulcers requires meticulous nursing care and a nurse who has experience with wounds. The most experienced nurse should be assigned this client. 3. The client with a laryngectomy has received teaching prior to and after the procedure and would not require extensive teaching or nursing care, therefore, this client would not require the most experienced nurse. 4. Discharge teaching starts on admission into the home health care agency. Therefore, most of the teaching would have been completed, and this client would not need the most experienced nurse. Content: medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. 42. 1. Hospice is a service for clients who have less than 6 months to live. If the client has been told she will die very soon, then this is probably less than 6 months. If the client does not die within the 6 months, she will not automatically be discharged from hospice. Each client is assessed individually for the need to remain in hospice care. If the client does not want any heroic measures and wants to die at home, then hospice will provide these services. This intervention would be appropriate for the HH nurse. 2. The HH nurse is not responsible for discussing the client's prognosis. The oncologist would have to write a letter stating the client had less than 6 months to live to be placed on hospice services. The client should discuss this with the oncologist, not the HH nurse. 3. Because the client is crying and upset, it would be more appropriate for the nurse to discuss a plan for living and hospice services than to discuss what is going to happen after she dies. At some point this should be done, but this is not an appropriate time. 4. The client does have a right to a second opinion, but the nurse should not tell the client this unless the client is questioning the diagnosis. Content: management of care, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, psychosocial integrity, cognitive level, synthesis. 43. 1. The client is an adult and the nurse must respect the client's confidentiality. The nurse does not have to tell the children. 2. This is giving advice and is not the nurse's role. 3. The nurse not telling the children respects the client's wishes and confidentiality, but the healthcare providers should be told of new client's circumstances, as the information applies to the client's care. 4. This is a therapeutic response, but the client did not indicate that she or he thought the nurse would talk about the client's status to the children. The client just wanted to tell someone. Content: end of life, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, psychological integrity, end of life care, cognitive level, analysis making nursing decisions. When the test taker is deciding on a therapeutic response, then the test taker must determine whether there is a response that directly addresses the problem or whether a therapeutic conversation is indicated. 44.1. This client may need oxygen or an intervention to keep the client comfortable. This client should be seen first. 292 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Chapter 10 Hematological and Immunological Management 293-2. This client does not have priority over difficulty breathing. 3. This client does not have priority over difficulty breathing. 4. This client does not have priority over difficulty breathing. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the test taker should apply some systematic approach when answering priority questions. Maslow's hierarchy of needs should be used when determining which client to assess first. The test taker should start at the bottom of the pyramid, where physiological needs are priority. 45-1. The medications are not important at this time. The client is bleeding. 2. The client is at risk for shock. The nurse should take steps to prevent vascular collapse. Starting the 4 is the priority. 3. This is not important in the emergency department. 4. Prevention of circulatory collapse is the priority. The nurse could anticipate an order for a complete blood count, CBC, and a type and cross match. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. Making nursing decisions, the test taker must be aware of the setting, which dictates the appropriate intervention. The adjectives will cue the test taker to the setting, in this case, the emergency department. The test taker must also remember the nurse's scope of practice. Starting and 4 with normal saline is within a nurse's scope of practice. 46-1. It is too late to ask this question. This decision must be made prior to an arrest situation. 2. The nurse should not hesitate to call a code, and a full code must be performed, not a slow code. 3. These are the first steps of a code. 4. This should be done by someone at the desk, not by the nurse responding to the emergency. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. Making nursing decisions, the nurse must react immediately in an emergency situation and should not hesitate. The nurse should immediately begin cardiopulmonary resuscitation, CPR, and follow the hospital's protocol. 47-1. The son has a right to refuse to come to the hospital regardless of what the nurse thinks the son should do. The nurse is unaware of the family dynamics that led to this dilemma. 2. This is only placing another healthcare professional in the picture and would not be the best option. 3. Other family members are more likely to understand the family dynamics and would be the best ones to intervene in the situation. 4. The nurse should attempt to assist in reconciliation between the client and her son if possible. Content: end of life, category of health alteration, oncology, integrated processes, caring, client needs, psychosocial integrity, cognitive level, application. 48. 1. This is an expected lab value for a client diagnosed with leukemia. The client's bone marrow is overproducing immature white blood cells and clogging the bloodstream. 2. This client is complaining of nausea, which is an uncomfortable experience. The nurse should attempt to intervene and treat the nausea. This client should be seen first. 3. Absent breath sounds are expected in a client diagnosed with lung cancer. 4. A negative biopsy is a good result. This client does not need to be seen first. Content: oncology, category of health alteration, oncology, integrated processes, nursing process, analysis, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions, when deciding which client to assess first, the test take. R should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is unexpected or causing the client distress. 49.1. Anticipatory nausea is a very real problem for clients diagnosed with cancer and undergoing treatment. If this problem is not rectified quickly and progresses to vomiting, the client may not get relief. This medication should be administered first. Answers 2. This is considered mild pain and can be treated after the anticipatory nausea. 3. This is expected and indicates the medication is working. This medication does not have priority. 4. This is a routine medication and can be administered after the nausea and pain medications. Sublingual nitroglycerin is administered for acute chest pain, angina. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 50. 1. Ineffective coping is a psychological problem that would not have priority on the first day after major abdominal surgery. 2. After major trauma, the body undergoes a fluid shift. The possibility of fluid and electrolyte imbalance is the top priority problem for 1 day after major abdominal surgery. 3. This could be a priority, but a potential or risk is not priority over an actual problem. 4. A potential psychological problem would not have priority on the first day after major abdominal surgery. Content, medical/surgical, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions, when the test taker is deciding which client problem is priority. Physiological problems usually are priority, and an actual problem is priority over a potential problem. 51.1. The nurse should address the client's spiritual faith, but at this time this is not the nurse's best response. 2. The nurse should not leave the client alone after receiving this type of news. 3. The nurse should ensure someone is with the client, but it is not the nurse's best response. 4. The nurse's best response is to stay with the client and allow the client to ventilate his feelings of denial, fear, and hopelessness. Content, end of life, category of health alteration, oncology, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. The nurse needs to be able to address the client's psychosocial needs and allowing the client to ventilate feelings is an appropriate intervention. A nurse who is a good listener is a very special nurse. 52.1, 3, and 4 are correct. 1. Spiritual distress can greatly affect the perception of pain. If the client is not receiving relief from pain medication, the nurse should explore other variables that could affect the perception of pain. 2. Clients experiencing chronic pain may or may not be able to rate their pain on a pain scale. The client has provided all the information about the pain that is currently needed. The pain is greater than it was before the medication. 3. This is an alternative to medication that may provide some minimal relief while other interventions are being attempted. 4. The nurse should notify the HCP that the current pain regimen is not effective. 5. This is a condescending statement and would tend to agitate the client more than help. Content, end of life, category of health alteration, drug administration, integrated processes, nursing process, assessment, client needs, physiological integrity, basic care and comfort, cognitive level, analysis 53. 1. The charge nurse should not assign a UAP to care for a client in spiritual distress. This is outside of the UAP's functions. 2. The charge nurse should not delegate or assign care based on a personal relationship of the nurse with the family. The nurse most qualified to care for the client's needs should be assigned to the client. 3. A hospice nurse has experience in managing symptoms associated with the dying process. This is the best nurse to care for this client. 4. A new graduate would not have the experience or knowledge to manage the symptoms as effectively as an experienced hospice nurse. Content: end of life, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions, when the test taker is deciding which option is the most appropriate task to delegate/assign, the test taker should choose the task that allows each member of the staff to function within his or her full scope of abilities. 54.1. The nurse could administer the Phenergan as a one-time medication administration or whenever the client asks for it, but this is not a proactive intervention. 2. Administering the PRN compazine prophylactically before meals is a proactive stance and assists the client in maintaining 294 prioritization, delegation, and management of care for the NCLEX-RN registered exam Chapter 10 Hematological and Immunological Management 295 his or her nutrition. This is the best action. If the client responds well to the regimen, the nurse should discuss changing the order to become a routine medication. 3. If the client responds well to the PRN compazine, the nurse should discuss changing the order to become a routine medication instead of just PRN. 4. The client did not complain of pain. Nausea can be caused by pain, but it can also be caused by any number of other reasons. The nurse should be concerned with controlling the symptom. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis 55. 1. The infection control nurse should evaluate the problem fully before deciding on a course of action. 2. The infection control nurse should assess the staff member's delivery of care and use standard nursing practice before deciding on a course of action with the unit manager. 3. This is an action that will allow the infection control nurse to observe compliance with standard nursing practices such as hand washing. Once the nurse has attempted to determine a cause, then a corrective action can be implemented. 4. The entire hospital has not shown an increased infection rate, only one unit has shown an increase. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, safe and effective care environment, safety and infection control, cognitive level, synthesis 56. 1. The UAP may be at risk of contacting the illness. 2. The UAP should wear appropriate personal proactive equipment when providing any type of care. 3. The UAP should not be told to skip performing assigned tasks. 4. The fetus is not affected by anthrax, so a pregnant nurse could care for the client, taking the same precautions as a nurse who is not pregnant. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 57. 1. The mortuary service is considered part of the healthcare team in this case. The personnel in the funeral home should be made aware of the client's diagnosis. 2. The mortuary service is considered part of the healthcare team. In this case, the personnel in the funeral home should be made aware of the client's diagnosis. 3. The nurse does not need to ask the family for permission to protect the funeral home workers. 4. The nurse, not the HCP, releases the body to the funeral home. Content: end of life, category of health alteration, hematological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, comprehension 58. 1. This is the correct procedure when coming into contact with blood and body fluids. The nurse does not need to intervene. 2. This may be wasteful if the linens are not used because the client is discharged, but it does not warrant immediate intervention by the nurse until the unit has a problem with linen overusage. This action saves the UAP time. 3. This is the correct procedure for getting ice. The nurse does not need to intervene. 4. Massaging pressure points increases tissue damage and increases the risk of skin breakdown. The nurse should intervene and stop this action by the UAP. Content: medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, analysis, client needs, safe and effective care environment, management of care, cognitive level, application 59. 1. This client has had a common surgical procedure and is not experiencing a complication. The least experienced nurse could care for this client. 2. Green bile in a T-tube is expected, but a gray tint to the drainage indicates an infection. An experienced nurse should be assigned to this client. 3. A popping feeling when ambulating indicates the hip joint may have dislocated. An experienced nurse should be assigned to this client. 4. A Whipple procedure involves removing most of the pancreas. The symptoms indicate the client is not metabolizing glucose, symptom of diabetes mellitus. An experienced nurse should be assigned to this client. Content: medical/surgical, category of health alteration, genitourinary, integrated processes, nursing process, planning, client needs, safe and answers effective care environment, management of care, cognitive level, synthesis 60. 1. The unit manager should talk to the client first, not ask the night charge nurse to watch the nurse. This step may be needed if a doubt does surface about the nurse's performance. 2. This is the second step in this process if the manager determines the complaint is valid. 3. The first step is to discuss the complaint with the client. This step lets the client know that the client is being heard, and the manager is able to ask any questions to clarify the complaint. 4. The occurrence may need to be documented and placed in the employee's file, but this is not the unit manager's first intervention. Content: management, category of health alteration, oncology, integrated processes, communication and documentation, client needs, safe and effective care environment, management of care, cognitive level, application 61. 1. This is blaming the client. No one has the right to abuse the client. 2. The nurse must assess the client's safety and provide a referral to a women's center. This is the nurse's best response. 3. The client does not owe the nurse an explanation of her feelings. This is not a good response to the client. 4. The nurse is advising. The decision whether to leave the abuser or not must be the client's decision. Content: management of care, category of health alteration, musculoskeletal, integrated processes, caring, client needs, psychosocial integrity, cognitive level, synthesis 62. 1. Even though the spouse of the client is making the request, the nurse should still check to make sure that the client has listed the husband as being allowed to receive information. The Health Insurance Portability and Accountability Act, HIPAA, regulations do not allow for release of information to anyone not specifically designated by the client. 2. The nurse cannot do this unless the client has designated that her husband is allowed to receive information. 3. The HCP as well as the nurse must abide by HIPAA. 4. The HCP is responsible for divulging biopsy results. If the spouse is present when the HCP enters the room and the client allows the spouse to stay, then consent for receiving information is implied. Content: legal, category of health alteration, oncology, integrated processes, communication and documentation, client needs, safe and effective care environment, management of care, cognitive level, comprehension 63. 1. The clients would not understand the importance of the specific tasks. Clients will tell the nurse whether the UAP is pleasant when in the room but not whether the delegated tasks have been completed. 2. The nurse retains responsibility for the delegated tasks. The charge nurse may be able to tell the nurse that the UAP has been checked off as being competent to perform the care, but would not know whether the care was actually provided. 3. The nurse retains responsibility for the care. Making rounds to see that the care has been provided is the best method to evaluate the care. 4. The nurse would not have time to complete his or her own work if the nurse watched the UAP perform all of the UAP's work. Content, management, category of health alteration, oncology, integrated processes, communication and documentation, client needs, safe and effective care environment, management of care, cognitive level, synthesis 64. 1. A client in a crisis should be assigned to a registered nurse, RN. 2. Biliary atresia involves liver failure and multiple body systems. This client should be assigned to an RN. 3. Anaphylaxis is an emergency situation. The client should be assigned to an RN. 4. The LPN can administer routine medications and care for clients who have no life-threatening conditions. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 65. 1. Erythropoietin stimulates the bone marrow to produce red blood cells. An adverse reaction to epigen is hypertension, which this client has, with a BP of 200/124. Hypertension can cause the dose of erythropoietin to be decreased or discontinued. 2. Epigen does not affect the pulse. 3. A hematocrit of 38% would indicate the medication is effective. 4. A side effect of the medication is long bone pain. This can be treated with a non-narcotic analgesic. This is not an adverse reaction. 296. Prioritization, delegation, and management of care for the NCLEX-RN registered exam Chapter 10 Hematological and Immunological Management 297. Content, medical/surgical, category of health alteration, hematological, integrated processes, nursing process, evaluation, client needs, physiological eye integrity, pharmacological and parenteral therapies, cognitive level, analysis 66. 1. The nurse should assess the client for complications before administering the medication. 2. This should occur, but not before assessing the client for complications. 3. The first step in administering a PRN pain medication is to assess the client for a complication that may require the nurse to notify the HCP or implement an independent nursing intervention. 4. This is not the first intervention. Content, medical/surgical, category of health alteration, hematological, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis 67. 1. Clients diagnosed with acquired immunodeficiency syndrome, AIDS, may have body image disturbance issues related to weight loss and Kaposi sarcoma lesions, but these are psychological problems, and physiological problems have priority. 2. Impaired coping is a psychological problem, and physiological problems are priority. 3. The basic problem with a client diagnosed with AIDS is that the immune system is not functioning normally. This increases the risk for infection. This is the priority client problem. 4. Self-care deficit is a psychosocial problem, not a physiological problem. Content, management of care, category of health alteration, hematological, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis 68. 1. The infusion of antineoplastic medications is limited to chemotherapy and biotherapy competent registered nurses. A qualified registered nurse should be assigned to this client. 2. This client should be assigned to a registered nurse who can answer the client's questions about the cancer and cancer treatments. 3. This client is pre-op, and the LPN can prepare a client for surgery. A 22-pound tumor indicates a benign ovarian cyst. 4. An experienced registered nurse should be assigned to this client because the client is unstable, with unrelenting pain. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 69. 1. A low WBC count is expected in a client diagnosed with leukemia. This client does not need to be assessed first. 2. A client diagnosed with a brain tumor would be expected to have a mild headache. This client does not need to be assessed first. 3. The client is upset and crying. When all the information in the options is expected and not life-threatening, then psychological issues have priority. This client should be seen first. 4. Dyspnea on exertion is expected in a client diagnosed with lung cancer. This client does not need to be assessed first. Content: medical/surgical, category of health alteration, oncology, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 70. 1. A butterfly rash is one of the clinical manifestations of SLE. This statement does not alert the nurse to a new finding. 2. Photosensitivity is a clinical manifestation of SLE and does not alert the nurse to a new problem. 3. Bright red in the bedside commode indicates blood, alerting the nurse to possible renal involvement. The healthcare provider must be notified so that diagnostic test can be ordered and steps taken to limit the damage to the kidneys. 4. Joint stiffness is related to the SLE and is a clinical manifestation. The nurse will medicate the client for pain, but the priority is to limit damage to the kidneys. Content: medical/surgical, category of health alteration, altered immune response, integrated processes, nursing process, assessment, client needs, health promotion and maintenance, cognitive level, analysis. Making nursing decisions. When deciding on the priority, the test taker must decide between clinical signs/symptoms that are normally found in clients who have the diagnosis and are not life-threatening and those that can be life-threatening or life-altering. 71. 1, 2, and 3 are correct. 1. The client's daily weights will provide information as to fluid balance and nutrition deficits. 2. The client's preferred foods can be used to help increase the client's appetite and should be provided whenever possible on the meal trays. TT Max Carruthers 18 answers 3. The dietitian can be the nurse's best ally when caring for a client with nutritional problems. 4. Glucose levels are monitored when a client is on total parenteral nutrition, TPN, not for a client newly diagnosed with a nutritional problem. 5. This would be appropriate for a client on TPN. Content: medical/surgical, category of health alteration, altered immune response, integrated processes, nursing process, assessment, client needs, health promotion and maintenance, cognitive level, analysis. Making nursing decisions, the test taker must note words that give a hint as to the extent of a problem, such as newly, in the stem of the question. This eliminates options 4 and 5. Words matter. Left or right, only, all words such as these can eliminate or define the option. 72. Correct answer: 2, 4, 3, 1, 5, 2. Of the steps listed, the nurse should check the client's hemoglobin and hematocrit. Most healthcare facilities have a procedure to administer PRBCs only when the H/H are less than 8 and 24. Blood is a scarce commodity, and unless the client is scheduled for surgery, there are other means of providing care of the client without the administration of blood products. 4. The client must consent to receiving blood and blood products. If the client will not allow the blood to be administered, then the procedure stops here. 3. The nurse must determine the client's physical status prior to picking up the blood in case the nurse assesses a client's situation that requires the nurse to get in touch with the healthcare provider. 1. If ordered, a diuretic is usually administered between the units of blood to prevent fluid volume overload. 5. The blood bags can be returned to the laboratory after the blood has infused. Content: medical/surgical, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, health promotion and maintenance, cognitive level, analysis. Making nursing decisions, rank order questions can be answered by the test taker placing himself/herself at the client's bedside and asking, "What would I really do first?" 73.1. Methotrexate can cause fetal abnormalities or loss of the fetus. The client should be placed on birth control for the duration of administration of this medication and for 2 years post. 2. This is a standard instruction for many disease processes, but it is not priority over prevention of pregnancy. 3. This medication can produce nausea and nutritional intake is important, but not over preventing a pregnancy and possible complications. 4. Keeping a diary of symptoms and questions is a good idea, but the priority is to prevent an unplanned pregnancy. Content: medical/surgical, category of health alteration, altered immune response, integrated processes, nursing process, implementation, client needs, health promotion and maintenance, cognitive level, analysis. Making nursing decisions, if the stem of the question gives an age, then it is usually an important indication of what the question is actually asking. In this question, an age and a gender, female, are both given. Anytime the client is a female of childbearing age, the test taker must consider there may be another potential client, the fetus. 74. 1, 4, and 5 are correct. 1. Females who are HIV positive are at risk for multiple gynecological problems. 2. This is not in the scope of practice of a nurse, and clients newly diagnosed are living 20 years or longer with the virus. 3. Nothing in the stem indicated a need for this referral. 4. Hard regimens are responsible for the improved prognosis of HIV plus clients. 5. A healthy lifestyle will improve the client's ability to maintain her health. Content: medical/surgical, category of health alteration, altered immune response, integrated processes, nursing process, implementation, client needs, health promotion and maintenance, cognitive level, analysis. Making nursing decisions, when answering select all questions, each option is answered as a true/false question. One option cannot rule out another. 298. Prioritization, delegation, and management of care for the NCLEX-RN registered exam clinical scenario answers and rationales. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The newly diagnosed client will need to be taught about the disease and about treatment options. The registered nurse cannot delegate teaching to an LPN. 2. This is post-procedure care for a stable client, therefore, Ms. Mary could assign Ms. Brenda, the LPN, to care for this client. Ms. Mary cannot assign assessment, teaching, evaluation, or an unstable client to Ms. Brenda. 3. This client has hemoglobin of 6, which is extremely low. This client is not stable, and should not be assigned to Ms. Brenda, the LPN. 4. The LPN cannot administer antineoplastic, chemotherapy, medications to the client. The chemotherapy nurse must be an RN with additional education in chemotherapy medication. 2. This client is receiving treatments that can have life-threatening side effects. The nurse is not experienced with this type of client. 2. Bone marrow transplants are very specific to oncology clients, therefore, this client would not be appropriate to assign to a float nurse. 3. This is expected in a client with leukemia, but it indicates a severely low platelet count, a nurse with more experience should care for this client. 4. A medical surgical nurse should be able to care for a client who is 1 day postoperative abdominal surgery. Therefore, this client can be assigned to a floating nurse. 3.1. This is expected from this client and does not warrant immediate attention. 2. This is stomatitis and is expected with a client receiving chemotherapy. 3. Biological response modifiers that stimulate the bone marrow can increase the client's blood pressure to dangerous levels. This BP is very high and warrants immediate attention. 4. This client is experiencing steroid toxicity, which is called moon face and is expected. Therefore, this client does not warrant immediate intervention. 4.1. Ms. Kathy should assess the client's vital signs to determine if the client is hemorrhaging. Hypotension and tachycardia indicate hemorrhaging, potentially a life-threatening emergency. 2. The nurse may need to reinforce the dressing if the dressing becomes too saturated, but this would be after a thorough assessment is completed. 3. The nurse should assess the situation before notifying the HCP. 4. The client may be put in the Trendelenburg position. 5.1. MS. Paula cannot discontinue a subclavian line, this is a higher level nursing intervention. 2. Ms. Paula can empty the JP and reapply negative pressure. Ms. Kathy cannot delegate assessment, teaching, evaluation, medications, or an unstable client. 3. Evaluation of the effectiveness of a PRN medication must be done by the nurse. 4. The UAP should not do the initial colostomy irrigation, but the client would not have fecal output 2 days postoperative surgery. 6.1. A ureterosigmoidostomy is a surgical procedure wherein the ureters, which carry urine from the kidneys, are diverted into the sigmoid colon. It is done as a treatment for bladder cancer, where the urinary bladder had to be removed. This is expected. Therefore, it does not warrant notifying the HCP. 2. This may indicate the client has an incisional infection, but the HCP can be notified of this on rounds since this is not life-threatening. 3. The AP and B/P are within normal range. Therefore, this does not warrant notifying the healthcare provider. 4. This client is exhibiting signs/symptoms of peritonitis, which is a life-threatening complication secondary to abdominal surgery, therefore, the nurse should notify the healthcare provider. 7.1. Referral to hospice is an appropriate intervention for this client, but it does not apply to the identified problem of anticipatory grieving. 2. At this time the client should consider funeral arrangements, but the priority intervention is to assist the client to deal with the loss of her life. That is accomplished by therapeutic communication. Chapter 10 Hematological and Immunological Management 299 Scenario Answers 3. Therapeutic communication is the priority intervention for a client diagnosed with stage 4 cancer and an identified problem of anticipatory grieving. Allowing the client to work through the steps of grieving is accomplished by encouraging the client to express feelings. 4. An advance directive and a durable power of attorney for healthcare are appropriate interventions for a client diagnosed with stage 4 cancer, but this does not address the problem of anticipatory grieving. 8.1. An absolute neutrophil count of 681 indicates the client does not have sufficient mature white blood cells or granulocytes to act as a defense against infections. This client needs to be placed in reverse isolation and receive Neulasta, a biological response modifier. 2. A platelet count of 175,000 is within normal range. Thrombocytopenia is less than 100,000, therefore, Ms. Mary does not need to intervene. 3. A red blood cell count of 5 million is within normal limits. 5.0 times 106 1 million equals 5 million. 4. This HNH is a little low, but it is not life-threatening, therefore, this does not warrant intervention. 9.1. The nurse should complete an assessment of the lesion. This is not a common lesion found on Hispanic clients. 2. This is part of assessing the lesion and should be completed. The ABCDs of skin cancer detection include the following: 1. Asymmetry is the lesion balanced on both sides with an even surface. 2. Borders are the borders rounded and smooth or notched and indistinct. 3. Color is the color a uniform light brown or is it variegated and darker or reddish purple? 4. Diameter. A diameter exceeding 4 to 6 mm is considered suspicious. 3. Ms. Mary should document the findings in the chart, but it is not Ms. Mary's first nursing intervention. 4. Instructing the client to also notify the HCP to assess the lesion should be done, but does not have priority. 10.1. The HCP should be made aware of the AD so a do not resuscitate, DNR, order can be written. Only the HCP can write this order. MS. CAFE should notify the HCP to get the DNR written immediately. The order must be written before an arrest occurs or CPR will be initiated. 2. The AD should be discussed between the client and the significant others, but the AD is still valid even if the significant others do not agree, and the HCP can write the DNR order based on the client's wishes. 3. A copy is placed in the client's chart to notify all healthcare team members of the client's decisions, but this is not the priority intervention. 4. Giving the client a copy of the AD is good, but it is not the priority intervention. 300. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 301. Science may have found a cure for most evils, but it has found no remedy for the worst of them all, the apathy of human beings. Helen Keller. 1. Which client should the postpartum nurse assess first after receiving the AM shift report? 1. The client who is complaining of perineal pain when urinating. 2. The client who saturated multiple peripads during the night. 3. The client who is refusing to have the newborn in the room. 4. The client who is crying because the baby will not nurse. 2. Which newborn infant would warrant immediate intervention by the nursery nurse? 1. The 1-hour-old newborn who has abundant lanugo. 2. The 6-hour-old newborn whose respirations are 52. 3. The 12-hour-old newborn who is turning red and crying. 4. The 24-hour-old newborn who has not passed meconium. 3. The client in labor is showing late decelerations on the fetal monitor. Which intervention should the nurse implement first? 1. Notify the healthcare provider, HCP, immediately. 2. Instruct the client to take slow, deep breaths. 3. Place the client in the left lateral position. 4. Prepare for an immediate delivery of the fetus. 4. The nurse walks into the client's room to check on the mother and her newborn. The client states another nurse just took her baby back to the nursery. Which intervention should the nurse implement first? 1. Initiate an emergency code pink, indicating an infant abduction. 2. Ask the mother to describe the nurse who took the baby. 3. Determine whether the infant was returned to the nursery. 4. Ask the mother whether the nurse asked for the code word. 5. The nurse in the labor and delivery department is caring for a client whose abdomen remains hard and rigid between contractions and the fetal heart rate is 100. Which client problem is priority? 1. Alteration in comfort. 2. Ineffective breathing pattern. 3. Risk for fetal demise. 4. Fluid and electrolyte imbalance. Questions. Women's Health Management 11.6. The nurse working in a women's health clinic is returning telephone calls. Which client should the nurse contact first? 1. The 16-year-old client who is complaining of severe lower abdominal cramping. 2. The 27-year-old prima gravida client who is complaining of blurred vision. 3. The 48-year-old perimenopausal client who is expelling dark red blood clots. 4. The 68-year-old client who thinks her uterus is falling out of her vagina. 7. The charge nurse has received laboratory results for clients on the postpartum unit. Which client would warrant intervention by the nurse? 1. The client whose white blood cell count is 18,000 mm3. 2. The client whose serum creatinine level is 0.8 mg/dl. 3. The client whose platelet count is 410,000 mm3. 4. The client whose serum glucose level is 280 mg/dl. 8. The nurse on the postpartum unit is administering AM medications. Which medication should the nurse administer first? 1. The sliding scale insulin to the client diagnosed with type 1 diabetes. 2. The stool softener to the client complaining of severe constipation. 3. The non-narcotic analgesic to the client complaining of headache, rated as a 3 on a pain scale of 1 to 10. 4. The rectal suppository for the client complaining of hemorrhoidal pain. 9. The labor and delivery nurse is performing a vaginal examination and assesses a prolapsed cord. Which intervention should the nurse implement first? 1. Place the client in the Trendelenburg position. 2. Ask the father to leave the delivery room. 3. Request the client not to push during contractions. 4. Prepare the client for an emergency C-section. 10. Which newborn infant would the nursery nurse assess first? 1. The 3-hour-old newborn who weighs 6 pounds and 2 ounces. 2. The 4-hour-old newborn delivered at 42 weeks gestation. 3. The 6-hour-old newborn who is 22 inches long. 4. The 8-hour-old newborn who was born at 40 weeks gestation. 11. Which antepartum client should the charge nurse assign to the most experienced nurse? 1. The 34-week gestation client who is receiving Bredhine and is on strict bed rest. 2. The 36-week gestation client in active labor whose fetus has a biophysical profile of 10. 3. The 38-week gestation client who is 10 centimeters dilated and 100% effaced. 4. The 42-week gestation client who has been pushing for 4 hours and has yellow amniotic fluid. 12. A nurse has been floated from the medical unit to the postpartum unit. Which client should be assigned to this nurse? 1. The 4-hour postpartum client whose fundus is not midline. 2. The 8-hour postpartum client who has saturated 3 peripads in 1 hour. 3. The 14-hour postpartum client who experienced eclampsia during delivery. 4. The 23-hour postpartum client who is being discharged home this morning. 13. Which priority intervention should the nurse implement for the 38-week gestation client who is receiving epidural anesthesia? 1. Place the client in the fetal position. 2. Assess the client's respiratory rate. 3. Prehydrate the client with intravenous fluid. 4. Ensure the client has been NPO for 4 hours. 302. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 14. The 28-year-old female client is being scheduled for an emergency appendectomy. Which priority question should the emergency department nurse ask the client? 1. Are you currently breastfeeding? 2. Have you ever had general anesthesia? 3. Do you have any medication allergies? 4. Is there any chance you are pregnant? 15. Which client should the labor and delivery charge nurse assign to the most experienced nurse? 1. The client who has a fetal heart rate of 130 bpm. 2. The client who has non-reassuring fetal heart rate patterns. 3. The client who is scheduled for a cesarean section. 4. The client having a vaginal birth who has been pushing for 1 hour. 16. The female unlicensed assistive personnel, UAP, informs the nurse she has helped the 1-day postpartum client change her peripad 3 times in the last 4 hours. Which action should the nurse implement? 1. Ask the UAP why the nurse was not notified earlier. 2. Go to the room and check the client immediately. 3. Instruct the UAP to massage the client's uterus. 4. Document the finding in the client's chart. 17. The unlicensed assistive personnel, UAP, is assisting the nurse in the newborn nursery. Which action by the UAP would warrant intervention? 1. The UAP swaddles the infant securely in a blanket. 2. The UAP uses gloves when changing the infant. 3. The UAP is bathing the newborn with a bar of soap. 4. The UAP wipes down the crib with a disinfectant. 18. The charge nurse is making assignments in the labor and delivery department. Which client should be assigned to the most experienced nurse? 1. The 26-week gestational client who is having Braxton Hicks contractions. 2. The 32-week gestational client who is having triplets and is on bed rest. 3. The 38-week gestational client whose contractions are 3 minutes apart. 4. The 39-week gestational client who has late decelerations on the fetal monitor. 19. Which task should the nurse on the postpartum unit delegate to the unlicensed assistive personnel, UAP? 1. Instruct the UAP to prepare a sitz bath for the client. 2. Ask the UAP to call the laboratory for a stat-complete blood cell, CBC, count. 3. Tell the UAP to show the mother how to breastfeed. 4. Have the UAP check the client's fundus. 20. A nurse from the medical surgical unit is assigned to the postpartum unit. Which client should the charge nurse assign to the medical surgical nurse? 1. The client who has developed mastitis and is trying to breastfeed. 2. The client who had a vaginal hysterectomy and oophorectomy. 3. The client who is having difficulty bonding with her infant. 4. The unmarried client who is giving her child up for adoption. 21. The unlicensed assistive personnel, UAP, responds to a code in the newborn nursery. Which task should the house supervisor delegate to the UAP? 1. Tell the UAP to sit with the family in the waiting room. 2. Give medication to the nurse from the crash cart. 3. Assist the nurse anesthetist with intubation. 4. Instruct the UAP to obtain supplies for the code. Chapter 11 Women's Health Management 303 Questions 22. Which action by the nursery nurse would warrant immediate intervention by the charge nurse? 1. The nurse allows an experienced volunteer to rock an infant. 2. The nurse puts a gloved finger into the newborn's mouth. 3. The nurse performs the ortolani maneuver on the newborn. 4. The nurse requests the LPN to bathe the newborn infant. 23. The RN and unlicensed assistive personnel, UAP, are caring for clients on a postpartum unit. Which task would be most appropriate for the RN to assign to the UAP? 1. Perform an in and out catheterization. 2. Complete the client's discharge instructions. 3. Escort the client to the car and check for a car seat. 4. Spray anesthetic foam on the client's episiotomy. 24. The charge nurse is making assignments on the postpartum unit. Which client should be assigned to the licensed practical nurse, LPN? 1. The client who has delivered her 6th baby and has just returned to her room. 2. The client who had a C-section yesterday and is running a low-grade fever. 3. The client who had a vaginal delivery this morning and has foul-smelling lochia. 4. The client who is 1 day post-vaginal delivery who is ambulating in the hall. 25. The nurse and unlicensed assistive personnel, UAP, are caring for babies in the newborn nursery. Which action by the UAP would warrant immediate intervention? 1. The UAP does not check the mother's identification, ID, band with the infant's ID band. 2. The UAP brings the mother a full package of newborn diapers. 3. The UAP applies baby lotion to the newborn while the mother is watching. 4. The UAP tells the father to support the newborn's head. 26. Which task should the postpartum nurse not delegate to the unlicensed assistive personnel, UAP? 1. Tell the UAP to assess the vital signs of the client 4 hours post-vaginal delivery. 2. Request the UAP to pass out the breakfast trays to the clients. 3. Instruct the UAP to administer Regam to the client who is Rh negative. 4. Ask the UAP to remove the client's indwelling urinary catheter. 27. Which behavior by the unlicensed assistive personnel, UAP, warrants immediate intervention by the postpartum nurse? 1. The UAP helped the client with an episiotomy apply an ice pack to the perineal area. 2. The UAP pushes the PCA button for the 8-hour post-op C-section client. 3. The UAP uses non-sterile gloves to remove the client's peri-pad. 4. The UAP encourages the client to eat all of the food on the breakfast tray. 28. The charge nurse is making assignments on a postpartum unit that has 2 registered nurses, RNs, 2 licensed practical nurses, LPNs, and 2 unlicensed assistive personnel, UAPs. Which task/assignment is most appropriate? 1. Instruct the UAP to evaluate how the mother and infant are bonding. 2. Tell the RN to change the sharps container in the medication room. 3. Ask the LPN to administer ibuprofen to the client experiencing afterbirth pains. 4. Request the LPN to care for the client who is 6 hours postpartum who had eclampsia. 29. The nurse instructed the unlicensed assistive personnel, UAP, to provide a sitz bath to the postpartum client with hemorrhoids. Which priority intervention should the nurse implement? 1. Document the sitz bath in the client's nurse's notes. 2. Follow up to ensure the UAP gave the sitz bath. 3. Assess the client's hemorrhoids every 4 hours. 4. Discuss the importance of not getting constipated. 304. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 30. Which newborn should the charge nurse in the nursery assign to the licensed practical nurse, LPN? 1. The 4-hour newborn who was born at 42 weeks. 2. The 8-hour newborn who is jittery and irritable. 3. The 18-hour newborn whose mother was addicted to heroin. 4. The 22-hour newborn who was born vaginally after 2 hours of pushing. 31. The client being seen in the obstetric, OB, clinic tells the nurse, "I don't think it is right that the judge is making me get a contraceptive implant just because they don't think I am a good mother." Which ethical principle does the requirement violate? 1. Autonomy. 2. Justice. 3. Fidelity. 4. Beneficence. 32. The client in labor is diagnosed with pregnancy-induced hypertension and has preeclampsia. Which interventions should the nurse implement? Select all that apply. 1. Monitor the intravenous, 4. Magnesium sulfate. 2. Check the client's telemetry monitor. 3. Assess the client's deep tendon reflexes. 4. Administer furosemide, Lasix, intravenous push, IVP. 5. Notify the nursery when delivery is imminent or has occurred. 33. The father of a newborn infant tells the nurse excitedly, "Someone just took our baby and they didn't know the code word." Which action should the nurse implement first? 1. Tell the father to remain calm and go back to his wife. 2. Assign staff members to block all exits from the unit. 3. Page a code pink, indicating an infant abduction. 4. Question the father about what exactly happened in the room. 34. The client who delivered twins 3 days ago calls the women's health clinic and tells the nurse, "I am having hip pain that makes it difficult for me to walk." Which statement is the nurse's best response? 1. I am going to make you an appointment to see the HCP today. 2. This often occurs a few days after delivery and will go away with time. 3. Are you performing the Kegel exercises 10 to 20 times a day? 4. The pain may decrease if you empty your bladder every 2 hours. 35. The 36-week gestational client has just delivered a stillborn infant. Which intervention should the nurse implement? 1. Call the Sudden Infant Death Syndrome, SIDS, support group. 2. Refer the client to the maternal child case manager. 3. Notify the hospital chaplain of the fetal demise. 4. Contact Child Protective Services. 36. The client who is 20 weeks gestation comes to the women's health clinic, and the nurse notices bruises on her abdomen and back. Which response is most appropriate for the nurse? 1. Please tell me who is abusing you. 2. This could cause you to lose your baby. 3. How did you get these bruises? 4. Do you feel safe in your home? 37. The boyfriend comes to the postpartum unit and demands his girlfriend's room number. The nurse can smell alcohol on the man's breath, and he is acting erratically. Which action should the nurse implement? 1. Explain to the client her boyfriend is causing problems. 2. Give the boyfriend the client's room number. 3. Contact hospital security to come to the unit. 4. Tell the boyfriend that he can't be here if he is drunk. Chapter 11 Women's Health Management 305 Questions 38. The nurse is caring for a postpartum client who is a Jehovah's Witness and needs a ROGAM injection. Which question should the nurse ask the client? 1. Regam is a blood product. Do you want the injection? 2. Do you know what type blood your husband has? 3. Did you know that you have Rh negative blood? 4. Do you know whether your insurance will pay for the shot? 39. The nurse is administering medications to clients on a postpartum floor. Which medication should the nurse question administering? 1. The rubella vaccine to the postpartum client who has a negative titer. 2. The yearly flu vaccine to a client who reports an allergy to eggs. 3. The PPD to a client who suspects she was exposed to tuberculosis. 4. The hepatitis B vaccine to a client who is breastfeeding. 40. Which client would the newborn nursery nurse assess first after receiving shift report? 1. The newborn who has chignon. 2. The newborn with caput succedaneum. 3. The newborn who has a cephalohematoma. 4. The newborn who has a port wine stain. 41. Which statement indicates to the postpartum nurse the discharge teaching to the first-time mother is effective? 1. I should contact my baby's doctor if she refuses 2 or more feedings. 2. My baby will have green liquid stools for at least 1 month after I take her home. 3. I must administer aquamaphaton elixir once a day with formula to my